Hi, everyone, and welcome to another a great session of Real Talk produced by Let's Talk America with host Shana Thornton. I am Shana, and so excited that you are with us tonight on this Sunday for another Real Talk session. And tonight we are talking about something that is so real. We had so many write ins, so many comments in our inbox talking about the M word of menopause and also talk about perimenopause or premenopause. All of that as you're on the door of menopause or right before a few years. As you all know, I am no expert. I don't play a doctor on TV, but I happen to know some really, really smart doctors. And with us tonight happens to be a friend of this show and a personal friend of myself as well. I'm talking about the one and only, the acclaimed board certified OBGYN, Dr. Lori Johnson, giving you a virtual clap. Welcome back to the program, Doctor.
Thank you. It's so good to be here as always. I always appreciate the opportunity to educate the people and to get to chat with you a little bit.
Yeah, thank you so much for being on with us tonight. And we're going to get right to it. But you know better than anybody that we have a tradition here on Real Talk where we ask those that join us to tell us more about themselves and what got you here. I've seen your CV and resume. I know it's impressive. You're board certified, you took the test, you have treated thousands of women for different conditions from giving birth to treating STDs and also helping them through the journey of menopause. So we know all that, but personally, 2 minutes or less, Dr. Johnson, what got you here? You obviously a bright student, you go to medical school, you could have chose any segment of health out there. Why did you choose women's health? Help us out.
A couple things. One, it always fascinated me, the whole concept of how a baby is formed from an egg and a sperm and it develops and there's a fetus. It's always just been a fascinating thing for me, one. And then two, just to be able to educate women about their bodies and teach them a little bit about themselves. I mean, when you think about it, we most had health class like maybe seventh or eighth grade, age of 13 or 14. And we didn't pay attention. We didn't know. And so most of what we know knowledge-wise is based on what our mamas or sisters told us or what we may have read along the way. And although well-meaning, most of the information was just not accurate. It just wasn't the right information. And so we go through life thinking that things are this way or that way when that's just not actually the case. So that's why I love women's health. That's why I love telling women about women's health. And I can actually make change and affect them and give them better lives.
I love it. I love that. I love that you make it the human component of it, that you're saying we're talking about women and treating them for things that can be treated and not this notion, Dr. Johnson, as many years. And I've heard women as I was being raised and brought up say, well, it's just women stuff and you got to face it and you got to deal with it. And I love that we have real physicians like you that really address women and people for who they are, not just the physical part, but also the emotions and mental part that often come with the changes the body offers. And not just for menopause, but you know this better than I do, as women go through puberty, as young women go through puberty, as they choose to also give birth and have babies. The body is constantly changing. And tonight we are knocking on the door of menopause and we're going to talk about it. So let's get right to it. For everyone that's watching, and I want to say this, I do encourage our male listeners and viewers to also participate and engage. Come on, everybody. So I don't want you to say this is a women's show. There's nothing in this for me. You have mothers, you have daughters, you have sisters, you have friends, you have significant others and spouses that you care for and you love. This is something that all women, if they live long enough, right, Dr. Johnson, are going to certainly experience. So instead of going by the myths of it and she's going to get moody, she's going to start acting a certain way, let's get to the root of it and let's really have an educated and informed conversation. I've got to ask this because I don't want us to assume anything. First and foremost, define to us in your physician, but define in layman's term, what exactly is menopause? And obviously it affects women, but I don't want to say obviously because there are a lot of different things that are going on now as people transition to different genders as well. Who is impacted by menopause? And tell us more about it.
Everybody, all women and men go through something that's called andropause. And that means, so basically what happens is when you hit puberty, 10, 11, 12 years old, you begin to create these hormones, right? You're getting large numbers of hormones. The three primary sex hormones are estradiol, progesterone, and testosterone. Women and men both have some of these, but in varying components. Men clearly have much more testosterone than women do. Women have more estradiol than men do, but we all start to generate these hormones at pretty high levels at about the age of 12, 13, right? And that's what starts your cycle, your menstrual cycle, and it starts to go. And, you have one every month, and it kind of is a nice pattern. You go up, you have a cycle, you go up, you have a cycle. And that happens for 30, maybe 40 years, right? And then sometime like in our mid to early 40s, sometimes, even earlier than in some women, we see those levels begin to decline. And so the levels were like, let's just throw a number out and say your estradiol number was 65. Right now we're seeing it get lower. It may be down to 20. It may be down to 5. And eventually they go almost all the way completely. So what happens with the process of menopause is everything that those hormones were doing in your body for those 35 or 40 years now is lack, or a really basic term I call the hormone withdrawal. And so everything that your body was experiencing, the benefits of having those hormones, it doesn't have them anymore. And it has to re-regulate itself to not having those hormones. So that's the most basic terms I could give. And we get into menopause in particular. For a lady, that means she has not had a menstrual cycle for a full 12 months. Now, if you've had like a hysterectomy or something like that, where they took your, as they say, a partial hysterectomy, where you still have ovaries, you will still go through menopause. It's just that you won't necessarily know when, because you haven't had a cycle since they took your uterus out. But your ovaries will eventually decline in functioning over time, and you will still have the symptoms. So that's basically like a withdrawal of everything the hormones were doing when you were young. They're not doing them no more.
Wow. Okay. So you explained that beautifully. And I'm going to make this just from layman terms of Shana, right? Being a podcaster, a journalist, publicist. I'm going to make it this way. So I once had a physician explain sort of when a woman's hormones crash after a baby. And she said, if your hormones are going, there's a whole lot of estrogen things going for these 9 months. And then you have the baby, and often there's all sort of everything kind of comes out. There's a crash. Hence why some women may have, as you know, some postpartum, some severe symptoms. Is that similar? So you're saying, although it's 35 years in the making, right? Whenever that woman could get it early 40s, and it varies from woman to women. We're going to talk about a little pinpoint more when a woman can expect hers to kick off. But you're saying basically all that built up over a lifetime that may have allowed us to have children or didn't have children. You're saying in menopause that all of that is being addressed within a matter of some years, which would be the journey of menopause or perimenopause or premenopause, if you will.
That's correct. So it's not as drastic as a baby where it's a sudden kind of boom. It's not as drastic, but it's more a gradual decline that again may take place over a number of 2 to 5 years. It just depends on the individual.
Wow. So it varies from person to person. Okay. Now you said it can be early 40s. It can vary. When can a woman expect to really kick off that journey? I've heard some physicians say different things, but what's your professional take?
I'm going to say people start noticing changes in general in like the mid 40s is what I'm going to say. And it may not be the hot flashes, and you still may be getting a cycle every month, but you'll start to see some other things, some other changes in your other behaviors. A lot of that's going to depend when you actually finish will depend on your genetics. A lot of times we tell people like whenever your mother went through it, you'll tend to go through it. So when mothers have earlier menopause in their early 40s, the daughters will follow suit as well. If the mother was menopause later into her 50s, well, you can kind of count on that being the same for you.
Okay, so try to go by what your mom did, but give or take. I guess you're saying don't hold true. Mom went through it at 55. There's a strong possibility that that woman can go through it at 47 or maybe late 50s. What's the latest you've ever seen a woman hit menopause?
Like 56.
Okay, so but generally by the late 50s, most women are done with that process.
Menopause. Correct.
Now tell us this, and we've got some great information coming in and questions as well. Ladies, men, we want you to put out the information. Stacy out of Atlanta said hello. She said she did have a friend, Dr. Johnson, that went through early menopause in her late 20s. Help us out. Was that likely due to a hysterectomy?
That is something we kind of classify as a little different. It's called premature ovarian failure. Okay. And that's a little bit of a different concept than actual menopause, but it is a possibility, but it's much more rare. But that's considered premature ovarian failure, because when you're under like 35 and your ovaries stop working, that's what that falls into. So that does happen.
So you're saying that is something termed a little different. Thank you so much, Stacey out of Atlanta. We have Latrina out of Atlanta that said this perimenopause is something serious. On that point, we've had so many women talk about that. And Trina, thank you for giving that shout out and being real with us, because we're real talk for real people. And I do want us to take the taboo and the gloves off, okay, ladies and gentlemen, because the only way we empower ourselves, and Dr. Johnson's a huge advocate of this, is to be real about things. And we thank you for being real with us. She said it's something serious. What symptoms is likely, Miss Trina out of Atlanta, speaking of when she's saying this perimenopause is something serious? And I want to touch on perimenopause. That's sort of when you're at the door or around menopause, right?
Correct. So again, the hormones are beginning to decline, right? And you may still be getting periods. They may not be super regular. They may be later than normal. They may be where you used to get them every 28 days. Now it's 42 days or it's 35 days. You may skip a month altogether. You may see all of a sudden they're coming closer than before. Like you can't seem to get on a good schedule. That's a part of it. But then there's other things like mood swings, like just extra irritable for no reason, more emotional, crying over things that you wouldn't have cried about in the past. Things like difficulty sleeping, being hot at night, waking up at night, hot, gotta take the covers on, covers off, put the fans on. All that's the beginning changes of perimenopause. Even if you're not getting flashes during the actual time, the night sweats and trouble sleeping seem to be, they kind of precede the actual cycle going away by about a year or two. Full transparency, I started getting severe migraines before my cycle would come, when I was kind of hitting it, and I thought I was dying. I thought I was stroking out, and it took some time and several doctor visits, because I thought my blood pressure and all these things, to finally for me to link that these migraines were coming a day or two before I would have a cycle, and then they would kind of go away. But I had never had migraines in the past, so that was a very new thing for me to have dealing having on migraines. I have some clients who talk about anxiety, and then a lot of married clients, let's just keep it real transparent, they lose their sex drive. So a lot of my clients come to me saying that they don't know, they feel they have issues with their marriages because the husband's like, well, you don't ever talk to me, never touch me, you never want to have it. And that too is a real thing that has to do with the hormonal decline that comes along with perimenopause.
Wow. We are talking about real talk for real people. You heard Dr. Johnson say that sometimes that you can actually have symptoms that you didn't have before, because you admitted your own self. Thank you for your true testament and your own journey of saying migraines, not having documented migraines before. Never. And then you, and of course, being a physician, you're empowered with information of saying this is connected to right when my cycle was to kick off. So I think I hear so many people not being medical like me. They'll say, I don't know where this is coming from, this knee pain or this headache. And I've always said, sort of in a sense, being a health journalist, but you've never been 47 before. You've never been 55 before. And so you're proving our point that the body can also present different things as we go through different physical and emotional journeys that could actually be tied to the condition of menopause or perimenopause.
Yes. 100%. Joint pain is not, like you said, joint pain, that's another thing. Because so the hormones, they affect so many aspects of our bodies. Yeah. People have tried to just box them into periods and sex. And it's just so much more than that. It has to do with our skin tone, with our mental clarity. So a lot of people say they get 45, can't remember nothing, can't forgetful, go in the room, what I come in the room for, gotta leave the room again. What am I looking for? Like, you know, you a project, you come back and say, oh, why is it still like this? Because you never finished. All those types of things happen as well. You know, the kid left their shoes on the stairs, which they did every day for the last 5 years. But today, you throw the shoes at the kid. Like, I'm gonna tell you. Why you do what's wrong with you? You're like, you're losing it. So
yeah.
There's so many things that come along with the transition that we don't always associate with being menopause. We just think it's other stuff. With the transition that we don't.
Oh, that's fine. Listening to you. So that is something certainly to consider. We are watching and we are covering, rather, you are talking about menopause and perimenopause here on Let's Talk America Radio, your award-winning podcast program. I'm Shana Thornton, your host, and I have the pleasure of having the one and only board-certified gynecologist, Dr. Lori Johnson, out of Atlanta Metropolitan, on with us now. And we are addressing the symptoms of menopause and perimenopause and premenopause and what that means to so many people around the world. We certainly thank your engagement. Latrina followed up and said she's been having brain fog, which you just mentioned, Dr. Johnson. She said body aches, night sweats, and very emotional. All the things you just said, you described it best. That sock or that toy was always on the staircase, but for some reason now it's more bothersome and more irritable, right?
Correct. Absolutely.
Yeah. I want to talk about the emotional part before we continue with more engagement from our viewers that are with us tonight. And we thank you. Put your comments, put your questions in. When we talk about people perhaps being more irritable, and we don't want to make a generalization for all people, but you as a board certified physician are saying, but it is real that a lot of women have reported over many, many years, right? This studying menopause or perimenopause or premenopause is not a 1-year deal. Obviously, the medical society and medical associations have been doing it for a very long time, collecting data. How can that impact relationships? I know you touched on it at the top of our segment of saying that's why everybody should be interested in the impact of menopause on women, because it affects the women in all the relationships she has with her children, her parents, her significant other. But tell us some of the things of how that can be. And maybe perhaps if we could go through some run-of-the-mill, mundane, I will say, therapeutic notes or life hacks that can make that perhaps encourage that whoever's in the relationship with her sort of keep everything at bay, if you will. If there's a magic dust snap that Dr. Johnson can give us on that.
I don't know about that, but we'll try. Well, I mean, yeah. I mean, you know, it does. I've had women tell me that they filed for divorce. Like whatever he was doing for the past 35 years set them off so much. They're like, I'm out of here, or their jobs, like, because they walk away like, what is it? And in general, the women feel like they can't reel it in. It's almost like you're watching yourself and you know you're doing, your reaction is way over exaggerated for the scenario, but you can't bring it back in. You can't control it. If you want to look at the behavior, you know, we talk about the Karens who are on they film on TV and they're acting out. Of course, we frame it in a particular way because it's usually tends to be racial, but they're all middle aged. All of them are like 40s and 50s. So if you look at the ages of all the Karens that we see, because something that somebody was doing that was not bothering them just set them all the way off. And so a lot of what I see them like they need some hormones. They need some help with that, navigating that, because it can be very difficult to get through that. I was talking about menopause. I started with my mom real quick. She was in the throes of menopause, and I wasn't even out of medical school. I had just graduated. And, you know, one night she just gets up and she's totally annoyed and she's angry. She's slamming stuff. And it's like literally 11, it's like 10 o'clock, 11 o'clock at night. We're all going to bed. I'm staying for the summer, so I moved to residency. And she was looking for a makeup brush at 11 o'clock at night. She has her pajamas on. I'm like, where are you going? That you need it right this minute. And it annoyed her to the point that it was a chaotic moment. And I was looking at her like, what is wrong with you? But whatever that situation was, had took it to the point of total rage. But she was in the throes of menopause, and unfortunately for a lot of our mothers and our grandmothers, they didn't really know how to get help. They didn't talk about it. They didn't deal with it. You remember that time your mom was just really, really mean and really, really angry? She's probably menopausal. But now there are treatments, there are therapies, there are that you can do herbal stuff to try to help control the symptoms. You can do hormonal things to help control the symptoms. But I think also one of the things is raising the awareness that this could be what it is also helps you navigate through that cycle.
Yeah. And I think that's so important. I think that's true with everything that people go through. Maybe type 2 diabetes, diagnosis of type 1 diabetes, diagnosis of cancers. I definitely think awareness empowers people. And you said something I think describes so much of what I've heard family and friends say over the years. They know it, but there's something they can't get a hold of. And I do want us to talk about solutions and therapeutic hacks or things that people can address, because we're presenting the concern that every woman, God willing, if she lives long enough, is going to go through. And how can she maintain those healthy relationships and not end up isolated by herself at the end because she finally got through menopause, but nobody's left around. So we don't want that either, Dr. Johnson. Certainly not. I do want to shout out. Thank you so much. We have a viewer on from South Carolina, Columbia, South Carolina. Thank you so much, Jay, saying heavier cycle. That's a great question. She's saying perimenopause or menopause or premenopause. Does the cycle change for some women? Can it get heavier? I'll say this, Dr. Johnson. I thought from my previous reporting, I always thought as time went on, the cycle got lighter for most women, but you're the expert. Help us out.
It can get heavier. It can develop benign growths inside the uterus called polyps, which are benign, but they make the cycles heavier. So that is a trend you can see. You can see that even with especially if you have fibroids, they can definitely get heavier as you approach that perimenopause. So there are a lot of women who notice in that couple of years, again, although the cycles are regular, they are heavier, crampier. Eventually, they get lighter and spaced out, but in between, they can be heavier.
Oh, wow. So don't always assume, because, it's like, well, you're about to stop getting your period or your cycle, that you're saying it's just going to disappear. You're saying it can actually get heavier before it happens, or you can actually get cramping, which some women will sort of associate with the younger they are. You're saying that could possibly occur, a return.
Correct.
Oh, wow. Interesting to do it. Stacy out of Atlanta says, can some women actually experience no symptoms at all? I've heard a few handful of women say that. They're saying they kind of breeze through and the doctor did the blood test and said you're done. So how true is that? Or is it perhaps they're being what I call a care bear and they're being positive and saying everything is wonderful? Is that possible?
Well, this is a really funny anecdotal story. I was at brunch with some ladies, and it came up in conversation that I'm a gynecologist, and so menopause came up, and they were talking, and then one lady there was in a relationship, and she was just saying how hard it was, and her partner was like, yes, we're going through it, and the other lady said, "Oh, I haven't really noticed anything at all." And I said, well, a lot of times if a woman is single, she doesn't notice it as much because there's no one there to balance off of. Most of my clients who seek treatment and therapy are married. And so he says, well, I'm single. I was like, well, there you go. Because when you are single and there's no one that you have to deal with at home, you can clean it up for work. You can pull it together to go to work and do your job, and maybe a little bit more forgetful, but nothing significant. But when you kind of come home and be quiet and be in the silence, and there's no one there to bother you, and no one there to talk to, and no one there to get on your nerves, a lot of times my single clients will say they don't feel anything. So I don't know. I'm not going to say that it's not possible for no one to have any symptoms.
Okay.
But most people have something.
And I think that's such a great point. We're highlighting menopause and perimenopause and premenopause here on Let's Talk America Radio with board certified gynecologist Dr. Lori Johnson out of Atlanta Metro. She is really, really educating and motivating us with some very, very interesting information. But I think that's a great point that my father would say is sort of logic, right? Or logical, because you're saying if I'm by myself, perhaps, and I'm coming in and out, there may be no one to note that I'm a little more irritable, right? I mean, let's just be real, because there's no one there to say, why are you cranked today? What's going on? You are very emotional right now. So maybe you think because you live by yourself and perhaps you're an empty nester that all is well in your mind, right? Because a lot of women, by the time some do go through menopause, their child or children are out of the home. But maybe perhaps if there's a significant other or children that still remain in the home, or if they live with family or a sister or friend, or brother, maybe they're a little more observant of what's going on. What a great point, because so many times when we talk about depression or other issues mentally or emotional, they'll often say sometimes people that can be real with you, close family or friends, will actually say there's something different going on with you.
Correct. And even in my practice, I will say that the majority of I do a lot of menopause therapy in my practice. And the majority of my clients who are on some type of therapy are married or have children at home or smaller children. My single clients, I'm pretty good. I'm fine. Okay.
All is well.
All is well. Okay, girl. Right. Yeah.
Hey, me, myself, and I. It works.
I'm good. Okay.
And we certainly don't want to make light of it. Like you're saying, some women do experience things at a different degree than others. Tell us this, how long is this cycle? Because, we have some ladies on and individuals saying it's no joke, the night sweats, the moodiness. How long can this last? Because I've heard stories, and I don't want to say horror stories, but stories where women have said it lasted over 3 to 4 years. I'm like, say what now?
Yeah, I mean, it can last a long time because it just depends on how long it takes those hormones to really go away. And then it's kind of like a lot of people find themselves just kind of like accepting their new normal, right? Oh, I'm getting old. I can't do X like I used to. I don't have the energy that I used to. I just don't sleep well, and that becomes they normalize those things. I just don't sleep good. I sleep about 3 hours a night, and I'm up. Or I wake up at 2 or 3 and I'm good. And so a lot of my clients, or I'm more anxious, a lot of my clients who come to me for hormone therapy, by the time they get to me, they've gone to their primary. So they're on sleeping medications. Yes. A lot of them are on antidepressants. They're on anxiety medications because they went with that set of symptoms and they've been treated for things like that. And they just kind of accept them that's just kind of how it's going to be. Oftentimes, unfortunately, they never quite associated with menopause. They just think, oh, it's getting older, or this is just what I have to do now, or all of a sudden, I have more anxiety than I ever had before. All of a sudden, no, your hormones have declined.
Yeah. And so that's important to know. Let me ask you this, and I want us to start talking about some therapeutic ways that people can address it. But when we are talking about, say, perhaps you saying the anxiety is higher because the hormones are changing in the body, I've got to ask this because it's real talk for real people, but obviously she's coming to an end at some point, right? It could be a matter of 9 months. It could be up to 3 or 4 years, as you said. God bless all of my lady friends out there if that's the case. But if that's the case, perhaps, and this could be deeper than the conversation we're having, perhaps, does that mean that anxiety, that depression, that moodiness could last? Or you're saying, no, it often can tamper off towards the end of the journey of menopause. Is that the thinking?
Sometimes it can and sometimes it doesn't. Sometimes it becomes a permanent fixture of that person's life post-menopausal. They're always a little more anxious. They're always on antidepressants, and that becomes like a permanent, unfortunately, a permanent fixture sometimes.
That's just
a lot of times, like the hot flashes get better and they subside, and they do better over time. They're not as intense or not as frequent, things of that nature. But a lot of times, some of the effects just are residual.
So that's a great point you just brought up. So I've always been under the assumption that when they have the night sweats or the moodiness, it would tamper off. But you just really enlightened me on something. You're saying even night sweats, just because the woman is finished with the process, you're saying there are perhaps women in their mid 60s and early 70s that are still having flashes?
Unfortunately, yes. Unfortunately,
Dr.
yeah, they do. And then there's the other stuff, right? Then there's let's keep it real. Then it's like the sexual functioning. It's the
Okay.
vaginal dryness. It's the
Okay.
atrophy. It's the painful intercourse. It's all of those things too. So that stuff never kind of gets better. That's kind of just what she's stuck with.
Oh,
Moving forward,
wow.
while they giving men Viagra and then they don't we dry it out. It's like we can't work with them.
Ladies, this is real talk for real people. Dr. Johnson
Yeah.
just informed me, and maybe many of you already knew. I was under the impression some of these symptoms will go away forever into La La Peter Pan world. She just gave us a wake up call. No, that's not often the case. But we're going to talk about some therapeutic ways to address it. And that's the power that you have. And it is certainly a blessing to be a woman. So I do want to certainly say that. This is just a bump in the road that some women have to go through. Okay, we've got some questions on here. We got to go to it. Latrina said, oh, goodness, hoping this is not a permanent fixture. Dr. Johnson kept it real with us. Thank you, Dr. Johnson. We're going to keep moving. But Nasha out of Atlanta said, I may have missed this, but have advances in medicine and knowledge help to advance treatment of the symptoms? You're right on time. We were just going to discuss that. So she's right. I mean, 50 years ago, we would see all sort of things on the shows where they would pop culture make light of women going through menopause. Have some of the therapies gotten better? I can imagine the evolution of antidepressants certainly have. Is that the case when addressing women and the symptoms of menopause?
There are improvements. They're coming, slowly, unfortunately, but they do come. Um, Here's the thing. A lot of the treatment modalities involve hormones.
Okay.
Many women have a big fear about hormones. About 30 years ago, this big study came out. Hormones are going to give you cancer. They're going to give you
Yes.
strokes. They bad. Don't do them. And so women are like, oh, I don't know. And then if they have a family history of any kind of breast issue, they're really like freaked out about that. And so there's a lot of fear. So I spent a lot of time re-educating on that. So I'm gonna stay here and touch on it for just 1 minute. So that big famous study was done with women high doses of a very synthetic
Okay.
hormone. Synthetic meaning made in the factory, nothing natural. Remember, I said at the beginning, your body was making these hormones in high
That's right.
numbers for 30 or 40 years.
That's
So it's
right.
not like your body doesn't know how to process the hormones. It does. It does. It's just that when you put a synthetic or like a knockoff or a fake hormone in your body, you will get those types of side effects because your body doesn't know how to process the synthetic portion of the hormones. So now there's a big trend between what they call natural or bioidentical hormones, meaning that the compound and the chemical structure is the exact what your body had made for several years. So those things are constantly evolving. They're constantly coming out with new stuff. Downside number 2, which is why it's important to vote. A lot of insurances don't want to pay for type of therapy. So a lot of those treatments are out of pocket to the patient. Even if
Oh,
they have decent insurance, they go there and the 1 month prescription is $200-$300 because they don't want to pay for it. So there's that,
okay.
and then a lot of us do other modalities such as hormone pellets, things of that nature, which are out of pocket anyway. So sometimes for that, you might as well just go on and get a pellet because the insurances aren't paying for them. They're paying for Viagra again. Like I said, they're paying for the
Okay.
men to get a Viagra, but they don't want to pay for our hormones, and we need them. And not just for flashes, for bone health, for heart health. We always talk about breast cancer, but the number 1 killer of women is heart disease. So the
Yes.
estradiol and things are protective of the heart.
Wow.
They protect our heart, which is why you see, if you look at the trends after menopause, the heart women having heart attacks and heart disease,
Yes.
it escalates. Why? We don't have hormones anymore. So those hormones are protecting our hearts, not
Mm,
just giving us periods, you
that's
know?
right.
So you would think that there would be more willingness to pay for them, but unfortunately there's not.
Wow. And such real talk for real people. We're talking about menopause, premenopause, and perimenopause, ladies. And if you are of age, and that would be anybody over the age of 40 or late 30s, it may be knocking on the door for you sooner or later. And God willing, you're going to live a long life with longevity. But with that will come the process of menopause. So get ready. Knowledge is power. You said something about as the hormones and the body changes and heart disease. One of the things I've always been taught by cardiologists and cardiac surgeons, women tend to have, younger women rather, tend to have high HDL, which is the great cholesterol that takes all the bad cholesterol, the triglycerides, and the LDL out. But as women go through menopause and as we get older and estrogen drops, that HDL number will also drop. And so we lose that extra protection. And is that an accurate way of looking at it, that some of the protection that young women have does go away as they begin to knock on menopause door?
Yes, absolutely, absolutely. The estradiol, the testosterone as well that's
Yeah.
in our body drop. The estradiol, they're protective of not just the heart, but also testosterone is protective against breast cancer. And
Wow.
honestly, testosterone is one of the first hormones to drop in a woman. That drops in our mid 40s. And so again, what's the number one predictor of breast cancer risk? Age. The older you get,
Yes.
right, the
Right.
higher your risk goes. So, and that's taking all other factors out. So again, we have hormones being more protective. They're also protective against what else? Alzheimer's disease.
Wow.
So there's several things that um, the hormones do for us that are not just about flashes, but really are helping to maintain our youth and our longevity.
Wow. And that's just what comes with the living and being thankful for the long years, right? But also
Mhm.
recognizing there are other things that come with it. I've got to ask this, and I know you talked about some therapeutic actions that are available for women that are going through menopause and perimenopause. But what about a healthy diet and exercise? I know that may not fix everything, but could that help with her mood? Could that help with dealing with
Yeah.
the anxiety?
Oh yeah, for sure, for sure. Healthy diet, exercise, lowering your fat content, animal fat
Okay.
content. I'm not saying go vegan and all. I'm not saying do that. If you choose to do that's great. You don't have to do that, but everything in moderation. And I think the main thing is processed foods. If you're going to eat as close to the natural food source as possible.
Okay.
For my clients, when I'm telling them to go to the store, stay on the outside. Don't go in the middle lanes. The bad stuff is in the middle. The best stuff has to be cold. The best
Okay.
foods have to be cold or otherwise refrigerated. So that's your produce,
Nice.
that's your fresh meats, that's your fish in the back,
Mm.
that's your fresh dairy, your eggs, all on the sides. If you can stay on the perimeter, if you will, of the grocery store, you'll tend to do better.
Awesome. I love that. So you're saying let's use some good practices, get out and exercise, move around, help with those joints. Because you said sometimes
Mhm.
through menopause or perimenopause, those joints start to settle in, as my grandmother would say. So you're saying get the exercise, try to eat right. I want to ask this, and I know some people are going to cringe and probably be upset with me, but talk to us if there's a correlation, and I don't know this. But when it comes to women in menopause or perimenopause, does excessive alcohol intake play a role, or there's no data to support that?
Not that I know of. I will say cigarettes do. Cigarettes will tend to put you in a menopause earlier. Women who tend to smoke heavily will have earlier menopause. So I can tell you that's a fact. I'm not alcohol, unless it's probably excessive alcohol. I would have not
But but I,
heard that.
but I will ask this, Dr. Johnson, and as a board certified physician, you may be able to answer this. But if you're talking about somebody going through mood swings, right, and being more
Mhm.
irritable, I'm only going to think just some basic logic. Excessive alcohol, we're talking about being irresponsible, obviously not being responsible with it. That would probably only make matters worse.
Yes. Oh yeah. Oh yeah. It's gonna make the highs and lows more erratic. So absolutely, absolutely.
Thank you. Someone out of Atlanta did say they were going to reference testosterone, and you mentioned that you said it begins to drop for women in their mid 40s as they approach menopause, and that's interesting because that's something we're so used to hearing tied to men's hormones. But you're saying,
Right.
if you can explain, women do have a level of testosterone, and it's, I'm assuming it's higher, obviously, the younger they are, and then as they age, it drops. Tell us about that process, and tell us, when it drops, what symptoms can come with that as it drops.
I'm glad you asked. Well, several actually. Testosterone is why, like I'll see couples and the husband and wife, they'll go on a diet, right? They'll eat the same exact food, do the same exact workout, and he'll drop 30, and she'll drop 6. And be like, oh my God, why did you drop so much? It's the testosterone. Testosterone helps us to burn fat, help us to build muscle. Testosterone helps to help us be leaner instead of fatter. So when men, so let's men for a minute, when they get that pudge after a certain age, that belly pudge they didn't used to have, their testosterone is dropping as well when they're going through androgens.
Okay.
But with us, it's harder for us to lose weight as we get older. We have to work out a lot harder and a lot more because our testosterone is kind of the first thing to go. That actually has to do with our night sweats, is the testosterone decrease. Oh. It also has to do with our decrease in our sex drive. So why men always want it and women don't want it as much usually, because they have way more testosterone. But in menopause, it also drops quite a bit. And so that's one of the mediators of the decreased sex drive. And even in going to talk about sex, the ability to have orgasm, a lot of that is testosterone mediated as well.
Wow. Thank you so much for explaining that. Speaking of weight, I know you said when someone goes on a diet, in terms of weight stability, is that impacted by menopause? I've heard so many women say, lose the weight you want to do by 40 because it's almost impossible past 40. And I'm assuming that's tied to menopause or perimenopause. But can some women actually gain more weight as they go through the process? Or have you had instances where you've had patients actually lose weight?
Not really. most of my clients complain that they gain.
I'm trying to give us hope, but Dr. Johnson keeps knocking me down.
I'm so sorry. I mean, you can lose weight after menopause, but you have to work at it. Like, it's not just gonna fall off. Like, it's not, that metabolism is gonna slow down. And you used to eat all that food and not gain the pounds. You're gonna gain some pounds now. So you have to adjust and be much more careful.
Well,
you can lose weight.
Yeah. I was going to say, not to interrupt you, but I want to say, in terms of eating what you want and then gaining later, I think that happens way before menopause, though, Dr. Johnson.
Well, I see some clients who just could always just eat what they want and just never really gain, and they tend to not. They can't do that anymore. They're like, all I eat is lettuce, and I still can't.
Just eat the chips.
Right. Dressing on it at least.
I've got a question. Does menopause or perimenopause or premenopause, does it have any impact on a woman's appetite? I know you said the metabolism tends to slow down the older we get with the drop in testosterone and estrogen, but does her appetite change any? Because I hear so many people, men and women, the older they get, saying they don't have the appetite they used to have. And obviously I'm talking about people that are more late 60s or 70s. But does the appetite tend to change with the onset of menopause?
I think those later years, maybe. I think because their metabolism, it has slowed significantly more by late 60s and the 70s. And so they just don't burn as fast. They just don't want to eat as much. But in that 40s and 50s, not that I've noticed or heard that people are saying they want to eat more. Everyone's trying to eat less because they all want to lose 20, 30, 40 pounds. Everybody wants to lose 30 pounds. Everybody. They buy shots off the internet. We're not talking about that today, but
I was going to say, I didn't want to, I am going to mention this because weight is something, and we're going to transition as we begin to wrap up this important conversation about menopause with the one and only board certified gynecologist, Dr. Lori Johnson, out of Atlanta Metropolitan. She's in the south side of Atlanta. I've got to ask this though, when people talk about eating and diets and wanting to lose weight, America has a fight and a war with obesity, right? And it starts way before menopause, in all fairness.
Yes.
But most people cannot put that on menopause. But there's a new onset of drugs out there, as you know. One popular one is Ozempic, and there are many others that people are using, and they're losing significant weight. I'm like, wow. And I know individuals that tend to take it when they're on the brink of menopause. And what are any thoughts on that when it comes to appetite suppressants or weight suppressants such as that? As a gynecologist, do you have any concerns, or what would you say to that?
I have a lot of concerns, honestly, just because most of the people lose muscle mass and not fat with Ozempic, and all those will go majority lose muscle mass. And then when they stop taking it, they gain the weight back. You have to stay on it long periods of time. And then there is a small subset of people who get some very significant permanent side effects from those drugs. There's something called gastroparesis. I have a 28-year-old patient who I've known for several years. She got Ozempic at a different doctor, and she developed something called gastroparesis, which is a big word for paralysis of your stomach. So your stomach stops being able to move food through. And so it's associated with lots of vomiting and nausea and things like that. And the current class action suit against Ozempic is based on people getting that side effect. And so, there are concerns. For me, I've not jumped on the train. I'm a person, you make a lot of money. I just, I haven't jumped on that train because I just feel like and you will lose weight for sure.
Yeah.
You will lose, you will lose muscle mass. You won't just lose fat. And I just feel like long-term effects are probably not going to be great for people in the long run.
Wow. And thank you for sharing your intake on that, because there's been a lot of talk about it. As some very famous celebrities have certainly used it and really told it the wonderful things about it. But you're saying long term, we still have not yet to see what comes of it. And that's fair.
Mm-hmm. Right.
Yeah, with it. Before we head out of here, I want us to talk about something that it comes up a lot in a previous profession that I had. That was a concern for some physicians and infectious disease physicians, and that's talking about individuals past 40 and a bump recently that we've seen nationwide in STDs for so many groups, not just groups over 40. But talk with us about the importance of safety and sex safety when it comes to people of all ages, because this, Dr. Johnson, better than I do. Many people will preach and advocate that over and over again to young people. But for some reason, when they're past age of 40, the conversation doesn't seem to be as prevalent. And we recently did a segment on HIV, and the infectious disease physician expressed her sincere concern about individuals, women and men, often coming out of divorces past the age of 40 years old, and not really having a grasp understanding of the importance of safe sex. And I want you to take it away right now. I want to put the spotlight on you, because as a physician who treats women, and you've treated many, many women for STDs, talk to us about, as women go through menopause, the reality that STDs is very, very real for some.
It is. It really is. And particularly in my, scenario, marriage is so, may or may not be okay. Husband may be cheating, maybe stepping out. You have concerns. When your doctor asks you about STD testing, say yes. Say, yeah, test me. Just because I've had clients go, I don't need that. I don't need that. And then on occasion, there are certain bacteria that can be seen on the pap smear because they float. And then we'll get a call from the lab, although we didn't test for other STDs, they did find this one. So, what I do, we call patients all the time and give them this kind of news. And of course, it's never easy, but I test everybody. If you come in and tell me got your, let's run a test. Well, no, we don't know that. But again, we're in the age where people are divorcing. Sometimes people are widows and they're out here in the dating world again for the first time in 25 years, and they may or may not be using condoms. And um, they can get STDs. I mean, the whole gamut from trichomonas all the way up to HIV, herpes, all those types of things. We see them all the time in the 40 and over population. We see chlamydia, we see gonorrhea, we see all types of stuff, and it's quite common. And you can't be, and granted, if it's a marriage situation, it does open up a bit of a can of worms, because now I have to tell this married person, oh, by the way, you have this STD, and that opens up a whole nother conversation, clearly. However, it's my job as the physician to let you know what we found, to let you know that this is the situation. Because if something's going on and your partner is putting you in danger, then you need to know that. You need to know that whatever he's doing is endangering your life. And I will say this, there is what I think is a bias against testing men. I have had clients who test positive for a particular thing. They'll go tell their husband, and the doctor that they see doesn't test for that thing. And then the patient comes up, so my husband was negative. And when I asked them to pull the report up, I said, well, they didn't even test them for it. And that's happened on more than one occasion. It really bothers me. But they didn't test him for that. And she's like, what do you mean? I said, they didn't test him for what you tested positive for. And I'll write it on a paper and say, test for that. And sure enough, they'll be positive. So there's bias when it comes to testing men. There's bias when it comes to men going to get tested. And don't want to necessarily get tested. They say they went and didn't really go. So ladies, protect yourselves. When the doctor asks about STD testing, yep, test me for everything, just in case.
Yeah.
Unless you just haven't had sex in a really, really, really long time, just in case.
Yeah. So, and I want to emphasize this, because real talk for real people, you're saying if someone is sexually involved with someone in the coming in of a marriage or whatever it may be, because real talk for real people, there are people in different situations, get it. But I also want to say this, because we're saying the male, but also for same gender sexual relationships. I want that to be said, because I think there's a myth that it's only men that can give women things. So for same genders, right, that can also
Correct.
Things can transfer.
Correct. Especially if there are shared devices, shared toys, those types of things can be transmitted. I have a client now, funny you say that, who just tested positive for an STD. She said, well, I don't even for women. Well, whoever, that's what you got. What you got. And so you need to treat you for it, and treat her as well, because if you don't treat the partner, then you're going to keep giving it back to each other.
Yeah, well, and certainly it's important. I want you to say this as a gynecologist. It's important to treat the infection, right? Because whatever it is, it's not, well, people, because I think sometimes in the world we live in, there's what people consider the big one, right? HIV, but when it's chlamydia, gonorrhea, they're sort of like, they will say, oh, that's minor. But I know as a women's health advocate, and you want everybody healthy, men and women, I know you would say treat what's going on for the body to heal, right?
Oh yeah. Yeah, treat it, because the body is what they call sterile from the inside out, right? So everything beyond the vagina itself is closed off and sterile. When you introduce bacteria and pathogens to that goes up into the uterus, up into the fallopian tubes, up into the abdomen, and can cause infection, inflammation, scar tissue, all types of things. And you have to go get treated. And then the other part is, once you take the medication, go back and get retested to make sure you cleared it. Don't just take the medicine and go, good. Make that follow-up appointment. Go back for what they call a test of cure. Make sure the medicine did what it was supposed to do, and you don't need another course of it.
That's right. And so important, as someone who worked once in the pharmaceutical industry, make sure they're taking all of the medicine, right? Not just the symptoms have disappeared. If it's from an infectious cough or something STD related, make sure they're taking the full dose, right? Not when they're saying the symptom cleared up, Dr. Johnson, right?
Correct. Absolutely. Take it. If it's 5 days, take 5 days. If it's 3 days, take 3.
Yeah, ladies and gentlemen, we covered tonight a very important topic of perimenopause, premenopause, and also menopause. Dr. Johnson kept it real with us. She had us cringing on some, but she empowered us with certainly therapeutic actions that can take place and saying living with the new normal can be awesome. But she did let us know that it may not disappear, those symptoms. But that's a whole nother story. We keep it real on Real Talk. But Let's Talk America Radio. Before you get out of here and radio and podcast, I've got to ask this. I've heard you talk about this yourself on your social media platform. As women go through menopause and they're getting, some women are getting lighter periods, some are getting heavier ones, but for a lot of women, it's lighter. Some are beginning to skip and they're having night flashes. And the assumption that clearly a lot of times these women have grown children or they've got kids 14 or 15 and they're like, I'm out of the woodworks. And you have said you've had patient after patient come when they thought it was menopausal time and they're done with that and they pop up with a positive pregnancy test. We want to empower women. Please tell us, is it true or not? Going through menopause and night sweats and all that, if they are still sexually active with their partner, they can still conceive a child. Is this true?
Yes, yes. There is not an age cutoff. It is harder to get pregnant after a certain age, but there is no absolute cutoff. Oh, I'm 45, this can happen. No. If you are having periods sometimes, if you are sexually active and not on any kind of contraception, the possibility exists. So if be careful out there. If you don't want it, be careful. Be careful. I've delivered 45-year-olds, 46-year-olds. Just be careful. There is no cutoff age. I remember a couple of years ago, I was planning to do a hysterectomy on a patient, and we get there, and she pees in the cup the morning of the surgery, and she has a positive pregnancy test, and she was like, "Oh my God, I'm gonna have a hysterectomy. What is happening?" So that was no surgery for you today. We'll figure this out later on.
And so real. And I think in my grandmother's day, they would say the baby was made on the change.
Change life, baby. Yep.
In a nice way of thinking she had been done and the periods had gotten lighter and those days were over. And of course, they're involved with their spouse or significant other, and a baby pops up. So
yes, or the period test, or I just skip a couple of months, or you skipped a couple of months. You was like, okay, well, I'm good. I've skipped 3 months. I'm not gonna have none no more. And then you just take one egg to get through one time, and boom, there you go.
That's all it takes. That's all it takes. And so, and I want to make sure we're right on this. For it to be considered menopause to be over, like you've gone through menopause, is it true that it's 1 full year period free?
Yes.
Is it okay?
1 full year period free. So if you have gone 9 months or 10 months and that period comes back and you have bleeding, you have to start that clock all over again. It's 1 year from that date. Because once you have a period again, now if it's been a year or 2 or 3 and you haven't had any cycles and have some bleeding, please seek medical attention. That is a different conversation. It's called postmenopausal bleeding. Okay. Please seek attention for that. If it's been 2 years or 3 and you start to have bleeding again, that's a serious sign. But if you've only gotten 9 months, 10 months, and you thought you was home free and it comes back, you are back on the clock for another year.
You're back on it.
Study yourself.
Mm-hmm. And Dr. Johnson, I want to say this before we close up. A woman can go a full year without a period, but still have those symptoms of night flashes, being irritable and moody, and vaginal dryness, correct?
Yeah, absolutely. Absolutely.
So that you're saying that the menopause period, you ended that, but like you said, the symptoms can certainly continue past that.
Right. So that period can be over, but you can still have the flashes and all the other things.
And thank you for saying if you're having some bleeding after that full year. But I want to close on this before we get to some of the support comments, that just because a woman is finished with menopause, she likely still needs to come see a gynecologist, right? Am I right in assuming that? She shouldn't say, well, I'm done, I don't have to see Dr. Johnson again?
Yes, that is true. Even if you don't come every year, every 2 to 3 years for some of the different things that arise, some of the vaginal issues. If you're sexually active, you still need to come and get your PAPs. Just again, checks out different things, STD checks, even in older patients. So all that needs to still be taken care of.
And one of the topics we're going to discuss later in this year, you and I, but ovarian cancer does increase with age, right? So that's something that likely that's a good reason to still be seeing a gynecologist for, right?
Yes, absolutely. Absolutely.
Which of course we want to take that serious, a very serious cancer. All cancers are serious, but that's one I've seen some recent reporting on that can be hard to detect as well, right?
Yeah. Hard to detect and very, 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 and like you said, all cancers are serious, so I cringe when I say this, but that's one of the worst. There are a couple that are worse than others to deal
Yes.
with, and that's on the top list of some of the ones that are worse than others.
Before we get out of here, we talk about saying the full year, but I've lately heard a few of my girlfriends say there have been some blood tests that the gynecologists have given them to sort of say they're in the middle of menopause. Does this such thing exist?
The blood test they're talking about is something called an FSH, which is follicle stimulating hormone. And so, in general, the higher the FSH is, the more into menopause you are. Because FSH comes from a small gland in the brain called the pituitary, and it is what's telling the ovaries to kind of turn on and make an egg. So imagine the pituitary is the generator and ovaries are batteries. The batteries are dying, they're dead, they don't want to work no more. So the generator out more and more power to try to turn the batteries on. So the FSH goes higher and higher as the ovaries decline in function. And so as that gets higher, classically that woman is more into menopause. There are ranges. So when you
Okay.
see a very, very high number, you know, okay, you're much done. But then there are ranges where you can kind of be in the middle and you're not quite home free yet.
I see. And is that necessary to have this test or not really? Because I know I hear some people get it and some gynecologists don't order it.
I mean, it depends on what you want to do with the information.
Mhm.
I do a lot of biomedical pellet therapy in my office. You may have heard some of the brands, BioT, Avexpa, Sono pellet. And for what I do with those pellets, we have to get those numbers because we treat the patient based on what her numbers are. If you're
Okay.
not going to do anything with it or take any kind of
Okay.
extra steps for a treatment, you may not have to get it.
It may not be necessary. Okay. And one of the things I do
Mhm.
want to talk about because it's so important to so many women is hair. As far as hair growth, does menopause or perimenopause? I've heard some hairstylists say this that the drop in hormones can thin hair and some women can
Mhm.
lose hair. Is that true or is that a hairstylist myth?
That's true as well. That's part menopause, part
Okay.
heredity. There are women who have male pattern balding with the
Mhm.
sides and stuff, but that tends to run in their family. So
Okay.
there's if you have the two combined, then you have hair loss and thinning is a little higher.
And real talk for real people, very much the last question. I got to ask this because it's so many questions that have come through on our inbox as well. Unwanted hair in certain areas,
Mhm.
facial hairs, women's testosterone drop or the estrogen drops. Does that have something to do with maybe unwanted hair that she didn't notice at 23 that she's noticing at 53?
Yes, it does. As you get into menopause, it's more complex than levels. It's kind of like how the pathways and things are shifting, etc. What I will say is do not shave that hair. Do not start shaving your face. Don't shave your face. Wax it, but don't shave it. The more you shave it, the more you stimulate the growth. So if you haven't started shaving, don't go get you some wax it off, pull it off, go get some electrolysis, but don't shave that hair.
Got it. Thank you. Real talk for real people here. We've got some great feedback for you, Dr. Johnson, before you head out. Banasha out of Atlanta said, thank you for sharing all of this information. Tambria said, thank you both to Shana and Dr. Johnson for a much needed conversation. Thank you so much for that feedback. We appreciate it. Latrina said, very informative segment. Thanks so much, Shana and Dr. Lori. We appreciate you, everyone. Yolanda out of Atlanta said, thank you both for great informative conversation about menopause. Need to be talked about. Miss Edith out of Atlanta said, very informative conversation as always. Thank you, ladies. Miss Peggy out of Atlanta Metro said, great topic. Thank you to you both. Stacy said, this has been very informative. We thank you so much. Miss Edith said, good Lord, when you said that the symptoms can last past menopause. And also someone made a reference to some googly eyes when you said a woman giving birth at 46. Okay. So you're clearly not wanted by a lot of our viewers. Latrina said, right, the scariest part to me, I guess she was saying, perhaps when people can still get pregnant when they're on the change. And my grandmother had, many rest her soul, she turned 100 years old if she was alive a few days ago. She talked about women being on the change as I was growing up and having babies as well. And this Miss Peggy also said, my Lord, I think she was referencing when talking about women having children, perhaps past the time that they wanted to. And she also said she's free, for whom the Son set free is free indeed. That's right. Thank you so much, Miss Peggy. And Jay Harris out of Columbia, South Carolina, said, great information, Dr. Johnson. Great show, Shana. Thank you so much. Ladies and gentlemen, I want to say ladies tonight because I usually have the men on, but it was all ladies that commented. But I certainly see there are some males that were watching and viewing us. Thank you for sticking with us, everyone, because your health matters so much. And no matter where you are in life, if you're 25 right now, or if you're 65 or 75, your body matters. And we want a long life of great longevity and a life of quality. And that's why we'll continue to deliver the health segments that matter to you. Dr. Lori Johnson, one of my all-time favorite medical guests on this show. Tell us how our viewers can get in contact with you and tell us more about your practice in Atlanta Metro.
I am actually a little south of the city, Locust Grove, but come on down and see me. Follow me on Instagram at Dr. Lori J. That's Lori with an E. I am on Facebook at Lori Johnson. I am on Facebook at Just For You OBGYN. That is my practice, Just For You OBGYN. We Locust Grove, Georgia. Come see us, follow us. I know it's far, but I have clients I'm privileged to have clients come from Atlanta, from Lawrenceville, Georgia, from different places. So we try to create a great, warm environment for you. So please come see us, call us, DM me, follow me when I do videos and I talk about different things, like the videos, share them. Hopefully they give you some good information. It was a pleasure, Shana, to be here with you tonight, as always.
Always a pleasure to have you on. You've talked with us about so many great topics. We're going to continue. We're going to follow up with ovarian cancer, like I said, later in the year, to talk about some of those symptoms because knowledge is key. And we know screening is so key. So we're going to try to empower all of our ladies and gentlemen. Lakeisha out of Atlanta Metro, thank you so much. She said, thank you both for a great conversation. And we're going to end it with Banasha Berry, who said out of Atlanta Metro, awesome and a much needed topic. Thank you, Dr. Lori and Shana. You all stay with us. We've got more coming your way. We want to empower you. It's real talk for real people, and that's you. You've got this, ladies. Menopause is just one bump in the road, but with the power and the knowledge, Dr. Johnson said, we're going to get over it together. And we're going to need our male counterparts to help us. So all our silent viewers tonight of our men, thank you so much for sticking with us. We need you on this journey. It takes a village. After all, she's raising your kids, so be on board with her to be her best version of herself. Dr. Johnson, we'll see you soon. Have a phenomenal week, everyone. Take care and be safe and stay tuned in. Real talk for real people. I'm Shana Thornton, signing off.